In this second video on the history of American medicine, disease, and healthcare, we'll focus more on the 19th century. And soon after the United States was created, President John Adams, right before 1800, signed legislation that created a series of what they call marine hospitals funded by the government to care for and isolate sick seamen arriving off of ships. That clearly had its roots in the pest houses of colonial days. By 1870, a number of these hospitals operated as the Marine Hospital Service under the leadership of what they called a supervising surgeon, which of course was the forerunner of what we have as a Surgeon General that exists today. By the antebellum age, doctors still didn't fully understand the concept of germs, but the connection between disease and the natural world had grown even more obvious. People stressed that you need to return to a harmony with nature's laws. They might eat a special diet or do things in their daily routines that they thought were more in line with nature. And just as they had since the colonial era, people that could afford to do so would flee cities when outbreaks of disease occurred. In the 1840s and 1850s, a man named Sylvester Graham was on the cutting edge of nutrition in nature. He stressed health was really important. You had to be a vegetarian. You shouldn't eat meat. And he cited actually a passage in the book of Genesis in the Bible that said, urged the people to eat herbs and seeds, fruits and nuts instead of meat. He thought eating meat was the cause of so much disease. And he concluded that bread made from whole wheat flour, chewed well, would supply nearly all the basic dietary needs. And he also said that a diet would reduce dangerous sexual impulses, so long as people avoided salt in the same time. So, he hit upon some things that have some truth in it, and also kind of was off the reservation in other areas today. But anyway, Sylvester Graham is a forefront of the vegetarian and vegan movement. Graham began to market a special cracker, which was used specifically which employed specifically ground wheat, and of course that is where we get the today. If you ever heard of graham crackers, that's the genesis of that. I have a quote here from Sylvester Graham. Quote: "I subsisted on a quantity of coarse bread, so small that it was barely sufficient to sustain life. I, at the same time, paid particular attention to bathing and exercise. I had not proceeded far before I became as a little child. My mind underwent a most surprising change, and a flood of light was poured in upon it. It appeared to me that I could see into almost everything. I was a new creature, physically, morally, and spiritually," unquote. All because he was reducing his caloric intake and eating these ground wheat crackers. Different strains stressed different paths to health. It wasn't just eating whole wheat like Sylvester Graham, but the prohibition movement, abstaining from alcohol, was kind of tied in with this. Some people would say wearing light clothes instead of the usual heavy woolen garments, or some people would say sleeping on a hard mattress was therapeutic. Others said drinking large quantities of fresh cold water daily would lead to health, which kind of makes some sense. And others would say taking long cold showers. This was there are many things that kind of revolve around the way man operates in nature, and if you got too much removed from this, then you could get sick. It was during the antebellum age that you begin to see some new ideas in medicine, like osteopathy, which was muscular manipulation. Of course, today an osteopathic physician is somebody that sees all of the human bodily functions working together. You don't really specialize in one area, but you try to understand it in its totality. And also, it was the beginning of chiropractic medicine, which was kind of spinal adjustment, and both intended to return sufferers to a natural state that the thought of the early industrial revolution, the thought was, had moved Americans from and caused problems. One of the beliefs of the antebellum age people was that the hot spring waters that you had in various parts of the country had medicinal value. People would go soak in them, and that would restore them. And you still see vestiges of this in some of these late 19th century resorts that popped up, like Hot Springs, Arkansas. People would go there and take in the waters and come back rejuvenated. Looking at the antebellum age, there were three serious waves of cholera, which was an infection of the intestines in this period. The first began in India and swiftly spread across the globe through trade routes. And New York City, not surprisingly, was the first U.S. city to feel the impact. Between 5 and 10% of the total population in large cities ended up dying from this. It's unclear what ended the pandemic, but it may have been the change in climate or the use of quarantine measures. The outbreaks largely ended after the Civil War. A major advance in the antebellum age was the use of anesthetics. In 1844, dentist Horace Wells was the first to use nitrous oxide, which we might know of as laughing gas, as an anesthetic. 3 years later, Dr. James Young Simpson experimented on himself with chloroform, and 2 years after that, Dr. Crawford Long used ether as a general anesthetic during surgery. Chloroform became the most widely used anesthetic because it took effect faster and it wasn't flammable. During the Civil War, more soldiers died of disease than from fighting, which had basically been the case in many wars previously. The conditions in the Confederacy were particularly brutal due to severe shortages of medical supplies and physicians. Lack of hygiene and cramped quarters brought about epidemics of childhood diseases like measles, mumps, chickenpox, and whooping cough. Diarrhea, dysentery, and typhoid fever ravaged the South, even worse than the North. Here you can see some sick waiting for treatment at a hospital they'd set up. When I talk about the hospitals, obviously you're not talking about the really nice hospitals that existed. The North had a number of those better hospitals over. You can see on the right picture here. Most of the hospitals would be movable hospitals that would be in nearby cities, or they'll follow the army around, and they were very, very primitive. You can see one on the left, an example on the left here. In the Civil War, you're going to see an increasing number of women working as nurses, and women were doing a lot of things for the war effort, but nursing was an area that women really took off in during the Civil War. When both governments began hiring women as nurses in 1861, 1862, it was a great way for women to make additional money while the men were gone. And the women nurses came from all segments of society, rich and poor, and black and white, at least in the North. There were a couple of very famous medicine nurse-related women in the Civil War. Probably one of the greatest is Clara Barton. On her own at the outset of the war, Barton began to organize relief efforts for wounded soldiers from Massachusetts. She proved great not only at organizing other women, but in soliciting and distributing private donations. Matter of fact, she was so successful, the Army gave her a pass to travel throughout their medical facilities, and she often went to the front. Sometimes she was called the Angel of the Battlefield. At the war's end, Lincoln commissioned Barton to identify missing soldiers so families could be notified of their fate. After the war, later in life, Clara Barton helped found the famous American Red Cross, which still exists today. Another famous woman in the medical field was Dorothea Dix. As a matter of fact, because of her pre-war success in various reforms, the Army hired Dorothea Dix as its, quote, superintendent of women nurses. Refusing to be paid for her work, she not only hired and trained a large number of female nurses, she helped procure supplies. She was, however, quite strict. Said no hoops, no curls, no jewelry. They should wear only black or brown. And for that reason, some of the nurses sometimes called her Dragon Dix behind her back. In 1861, women played a critical role in the establishment of the United States Sanitary Commission, which I've briefly referenced earlier. The U.S. Sanitary Commission grew out of local efforts, and its goal was to sanction one large relief organization to oversee the military's medical program and coordinate relief efforts of local groups.
At first, many males in government didn't think women, or for that matter, civilians in general, should be involved in its medical services. This sentiment quickly ended when the need became obvious and the manpower and supplies were so short. At its peak, the United States Sanitary Commission had branches in 10 major northern cities and had over 500 agents. Besides providing nurses and helping with medical supplies, the U.S. Sanitary Commission helped wounded soldiers get pensions or find housing. They wrote letters for wounded soldiers. They'd even provide food to soldiers in the field. It was disbanded in 1878, but the idea of the Sanitary Commission was what led Clara Barton to find the Red Cross, which I just mentioned. I should note as well that they didn't have anything comparable in the South. As one Southern doctor said, we were too poor. One common malady among the soldiers was venereal diseases. It was so common that it's been estimated that up to 8% of the Union Army contracted some form of venereal diseases. It was so bad that the officers and the U.S. Sanitary Commission tried to get rid of some of all the prostitution that went along in these camp followers that would follow the army. If you were wounded and you needed surgery, good luck to you. Contrary to what many people believe, you didn't have to bite the bullet, as it was said. In most Civil War surgeries, you did have that chloroform I mentioned, and they'd soak it in a rag and put it over your face until you're out. And you can see that on the left rather here, and on the right you can see the surgeon's kits. Most surgeries involve the extremities, and that often led to amputations. Obviously, if you got hit in the torso, your life was probably over with, and you just bleed out. The doctors that performed these surgeries would do it outdoors in the light, and that kind of meant that thousands of soldiers could actually, see these frightening operations. And the surgeons were quick to amputate because they feared above all else infections. In the Civil War, the Union alone performed approximately 30,000 amputations, compared, for example, to 16,000 in the entirety of World War II. After a circular cut was made completely around the limb, the bone was sawed through, and the blood vessels in the front and back were sewn shut with silk or cotton ligatures. To prevent future pain, nerves were then pulled out as far as possible with forceps, cut, and released to retract away from the end of the stump. Ouch. Finally, clippers in a rasp was used to sort of smooth the end of the exposed bone. And this whole process was done quickly, not only because of the operations necessary, because of mainly the blood loss. In general, the closer to the torso, the higher the mortality rate for the operation. Amazingly, it's estimated that in better equipped U.S. Army, the majority actually survived their operations. Combat injuries, were common, and so you get these Matthew Brady and others taking pictures of these the people that survived the amputations, like the ones you see here. The war led to innovations such as new splints and traction, using screws and plates and rods for fixing bones. And there was tremendous advances in prosthetic limbs here. You can see one of them here, and the guy that's got one. After the war, the government published a massive book summarizing all the innovations and advances medically that had happened during the war to ensure that their knowledge wasn't lost and they were continued. Other medical books followed. Among the diseases feared during the war were malaria, yellow fever, and smallpox. Doctors often fought malaria with quinine, which they also used for dysentery. Trouble is, if it worked, it made your teeth fall out. I should mention that it was during the Civil War, but not in America. In 1864, the scientist and Louis Pasteur proved that germs causes disease, and you think of like the pasteurized milk and so forth. But that is after the war. That discovery is going to lead to a lot of disinfectants. During the Civil War, if they were doing surgery, they understood just from experience that alcohol lessened the chance of infection. So they would dump it in alcohol on a wound, and that must have hurt like hell. But after the war, of course, they were better about cleaning themselves before they performing surgery or whatnot. The medical organization of both armies was similar. Both had a surgeon general who supervised the entire military medical department. In turn, each army had a medical director that supervised the surgeons. Of course, naturally, the best surgeons were often used for the officers only. In any event, I should say, at the beginning of the war, what they would do is they would send non-combatants out under white flags to remove the wounded after battle. In the U.S. Army, however, a new medical director arrived in 1862, a guy named Jonathan Letterman, who you can see here, and he developed a system that sort of carried his name, the Letterman system, which saved thousands. It involved trained medical personnel in separate units to operate ambulances to retrieve the wounded. There was also, each one of these ambulances had standard medical kits issued with them. The Letterman system also rationalized and standardized the field hospital system, adding the idea of a triage doctor first, a doctor whose sole job was to sort of stem the bleeding so the guy didn't bleed out, and then once he stabilized that, pass him on to the next doctor for the more complicated treatment. By the end of the Civil War, there were a number of even hospitals that just focused on the sick, not the wounded. And if you're in the north, there were, if you're near the coast, there was also some hospital ships to treat and carry wounded. After the Civil War, of course, they understood the idea of germs now, but nevertheless, we have this influx of Southern Eastern European immigrants crowding into the tenement houses of these industrial cities, and they were living very unhygienic lives in these tenement houses. And so, not surprisingly, epidemics were very quickly spread in these very, very crowded tenement houses in the late 19th century. As disease flourished in these tenement houses, science is trying to keep up. In fact, several important vaccines were developed during the Victorian age. In 1879, there was the first vaccine for cholera. In 1881, the first vaccine for anthrax. The following year, 1882, there was the vaccine for rabies. In 1896, there was the vaccine for typhoid fever. And the following year, 1897, there was the vaccine for the plague. And here you can see an early needle there on the right. Just like today, of course, people were afraid of getting vaccinated, and there was a fear that they would get ill, and so you see this represented in the cartoon on the left, and the government would try to encourage people to be vaccinated, and there was even a resistance to the idea back then, like we have today, of government coercion in public health, and you can see that on the right. As the 19th century ended, X-ray technology revolutionized medicine. The first X-rays were invented in Germany, but the first X-rays in the United States took place in the 1890s. X-ray technology quickly advanced. With the knowledge of germs from Louis Pasteur and the evidence from all these tenement houses in these big industrial cities, the government did encourage public health campaigns, and not only vaccinations, but things like they were realized that you need modern water and sewer systems, and you need fresh air, and so the government did start spending on these public health campaigns in the Victorian age, industrial age. When Mary Mallon, an Irish immigrant cook in New York, was found to be a healthy carrier of the typhoid bacterium in 1907, she was confined for years by city health authorities and demonized in the press as Typhoid Mary. By the late 1800s, Congress had dramatically expanded the United States Public Health Service, which had been established in the late 1800s out of the Marine Hospital System. Among its new responsibilities was running Ellis Island in New York Harbor to screen and quarantine new arriving immigrants, and you can see a picture of it on the right. Among its new responsibilities were offices that grew into the National Institutes of Health, or the NIH, and the Centers for Disease Control and Prevention, or CDC, both, of course, which exist today. This concludes the second video, focusing primarily on the 19th century.